Today, we need to talk about something that affects nearly every single person watching this, whether you realize it or not: healthcare. Not as a political slogan, not as a talking point, but as a real, everyday pressure that shows up in your bank account, your stress levels, and sometimes in the hardest moments of your life. When you hear another announcement about healthcare reform, it's normal to feel skeptical, maybe even exhausted. For years, people have been promised lower costs, better access, and simpler systems, and yet premiums keep rising, prescriptions stay expensive, bills arrive weeks after appointments, filled with charges no one explained up front. So when a new plan or proposal is announced with bold language about lowering prices and fixing the system, it grabs attention, not because people automatically believe it, but because they want to believe it, because the current system feels unsustainable. Before we go any further, let me ask you something. When you think about healthcare right now, what emotion comes up first? Is it confusion, frustration, anxiety, or just plain fatigue? For most people, it's not just one feeling, and it's all of them at once. And that emotional reality is important because it explains why this moment matters. Recently, millions of Americans started seeing higher health insurance costs, not because they changed plans, not because they suddenly needed more care, but because additional financial help that many families relied on quietly expired. When those subsidies ended, premiums jumped, sometimes dramatically. For households already balancing rent, groceries, utilities, and medical expenses, that increase didn't feel abstract, it felt immediate. That's the backdrop against which this new healthcare plan is being discussed. The timing isn't accidental, it's responding to real financial pressure people are already feeling. Now, the first thing that needs to be made very clear is this: what's been announced is not a finished law. It's not a fully written policy with every rule spelled out. It's a framework, a direction, a statement of intent. That distinction matters more than most headlines make it seem. A framework tells us where policymakers want to go, but not exactly how they'll get there. Congress would still have to turn these ideas into actual legislation. Agencies would still have to write regulations. Courts could still get involved. That means many of the most important details, the ones that actually affect your coverage and your costs, are still unknown. And that uncertainty is both a weakness and a reality of how major healthcare changes always work. One of the biggest areas of focus in this plan is prescription drug pricing. This is an issue that cuts across income levels, political beliefs, and age groups. People across the country have had the same experience, standing at the pharmacy counter, hearing the total, and wondering how a medication that's been around for years can cost so much. The argument being made is simple on its face. Americans often pay far more for the exact same drugs than people in other wealthy countries. Same manufacturer, same medication, same dosage, different price tags, sometimes wildly different. The proposed solution is to link US drug prices to the lowest prices paid abroad, a concept often referred to as most favored nation pricing. In theory, if a pharmaceutical company sells a drug for less in another country, Americans should not be charged significantly more for that same product. Supporters say this would finally give the US leverage it has never fully used before. They argue that drug companies would be forced to lower prices if they want continued access to the American market. Critics, however, warn that the reality could be more complicated. They argue that companies might respond by raising prices overseas, limiting supply, or pulling back from certain markets altogether. Others worry about long-term impacts on research and development. What's important here is this: while some voluntary price reductions have already been announced for specific programs and situations, broad, across-the-board price drops for everyone are not guaranteed, at least not yet. Big percentage numbers get attention, but they often apply to limited cases rather than the entire system. Another major part of the plan focuses on where healthcare money actually goes. Right now, a significant amount of government assistance flows through insurance companies. Subsidies help lower premiums, but the money typically goes to insurers first, not directly to individuals. The idea being proposed is to change that structure, to send more of that money straight to people and let them decide how to use it for coverage, On the surface, this sounds empowering. More choice, more control, fewer middlemen. But healthcare markets are delicate systems. Small changes can create large ripple effects. If healthier people use that money to buy cheaper, less comprehensive plans, it could leave older or sicker individuals concentrated in more expensive insurance pools. That, in turn, could drive premiums even higher for those who rely most on robust coverage. This is where the tension between flexibility and stability becomes clear. Choice feels good, but risk sharing is what keeps insurance affordable for people who need it most. One of the biggest unanswered questions is how protections for pre-existing conditions would be maintained and enforced under a restructured system. Those protections are deeply popular, but they require strong rules to function properly. Transparency is another pillar of the plan, and this is one area where there is surprisingly broad agreement that change is needed. Healthcare pricing is often hidden, confusing, and revealed only after services are provided. Patients rarely know what something will cost until it's too late to make a different choice. The proposal calls for clearer price posting, simpler explanations of coverage, and greater disclosure around things like denial rates and wait times. The theory is that transparency creates accountability. If prices are visible, providers compete. If insurers' behavior is public, consumers can make more informed decisions. Whether transparency alone is enough to drive meaningful cost reductions is still debated, but there's little question that the current lack of clarity benefits institutions more than patients. Stepping back, what we're really seeing here is a shift in emphasis, from expanding coverage at almost any cost toward controlling prices, increasing visibility, and questioning who truly benefits from the current structure. Nothing has changed overnight. Your coverage hasn't suddenly shifted. Your next bill won't look different just because an announcement was made. But the conversation itself has moved. And in healthcare, conversations often determine what becomes possible next. What this could mean for you, and why the details will decide everything. If you've made it this far, you're probably thinking one very reasonable thing. Okay, but what does this actually mean for me? And the honest answer is, it depends on who you are, on how you get your insurance, on what Congress does next, and on how the healthcare market responds. If you have employer-sponsored insurance, you may not notice immediate changes at all. Most employer plans operate on longer timelines, with benefits negotiated annually. Drug pricing reforms could eventually lower costs for certain medications, but those savings often take time to filter through the system. If you buy insurance on your own, especially through the individual market, the stakes may feel higher. Premiums are already sensitive to policy shifts. Changes in subsidy structures, plan requirements, or risk pools could have noticeable effects, for better or worse. If you're older, managing chronic conditions, or rely on consistent access to care, stability matters just as much as affordability. Lower premiums mean little if coverage becomes unpredictable or insufficient when you need it most. This is why details matter more than slogans. Healthcare reform has a long history of sounding simple and turning out to be complex. Every time the system is adjusted, incentives change. Providers adapt. Insurers respond. Companies find new ways to protect their interests. The outcomes are rarely linear. One of the most significant political realities is that major healthcare reform takes time. Even when laws are passed, implementation can stretch over years. Rules are written, court challenges arise, administrations change, priorities shift. That means patience is required. But so is attention. It's easy to tune out after hearing promises that don't immediately affect your life. But the choices being debated now will shape how much leverage patients have, how transparent costs become, and how much financial risk individuals are expected to carry. There's also an emotional dimension that often gets overlooked in policy discussions. Healthcare stress isn't just about money, it's about uncertainty, not knowing what something will cost, not knowing whether something will be covered, not knowing whether a single illness could disrupt your financial stability. Any reform that genuinely reduces that uncertainty would be meaningful, even if it doesn't solve every problem. But there are risks too. Shifting responsibility without sufficient safeguards can increase anxiety rather than reduce it. Choice without clear information isn't real choice, and cost-cutting that ignores human consequences can backfire. That's why skepticism isn't cynicism, it's engagement. As more information emerges, there are a few key questions worth watching closely. First, how broadly will drug pricing changes apply? Will savings reach people with private insurance or remain limited to specific programs? Second, how will financial assistance be structured? Will direct support come with clear standards to ensure meaningful coverage? Third, how will protections for vulnerable populations be enforced? Promises matter, but enforcement mechanisms matter more. Fourth, will transparency rules have real teeth, or will they become another set of disclosures that are technically available but practically useless? These questions don't have easy answers, and anyone claiming certainty at this stage is oversimplifying a deeply complex system. What is clear is that healthcare is no longer an abstract policy debate for most people. Rising costs have made it personal, and when issues become personal, public pressure increases. That pressure can lead to better outcomes or rushed decisions. The difference lies in whether people stay informed and demand clarity instead of just comfort. So if you're feeling tired of hearing about healthcare, that feeling makes sense. But this is one of those moments where tuning out entirely carries its own risk. You don't need to become an expert. You don't need to memorize policy language. But paying attention to how these ideas turn into rules, or don't, can help you understand what's coming before it shows up in your mailbox or on your pharmacy receipt. Healthcare reform is never just about economics. It's about trust, about whether people believe the system is designed to protect them or profit from them. This plan, like many before it, could move things in a better direction, or it could fall short, or it could create new challenges alongside old ones. The outcome will depend on the details, the compromises, and the accountability that follows. For now, nothing has changed, but something has started. And sometimes, in a system as entrenched as healthcare, that's how real change begins,